Today there's over 100 inherited genetic disorders. Luckily, most of those are very rare, but they do run in families. Many of those are what we call single gene disorders, and usually both the husband and wife or the male and female partner have to be a carrier of those for the child to be affected. Sometimes the effect is 50%, sometimes it's 25%. But today, there is that ability to determine if a miscarriage has occurred before or if there's a family history, exactly what that genetic issue is. That can be identified, and a genetics laboratory can prepare what they call a DNA probe that will identify the presence or absence of that specific gene defect. So for the couple going through in vitro fertilization, you get eggs and you create embryos, then you can take a cell out of each of those embryos and analyze it for the presence or absence of that genetic disorder. And then obviously the unaffected embryo is then transferred back to the woman to achieve a pregnancy. I think in the future we will have a greater number of genetic diseases we can look for, perhaps with some of the more common ones. We don't have anything for Alzheimer's or those other common disorders, but single gene disorders are something that are very essentially curable today.